In this video, we're going to be discussing a manual technique known as manual tibiofemoral traction. Now, tibiofemoral really just refers to the knee, so really you could just call this manual knee traction, but often you'll see tibiofemoral. And this technique is usually pretty good for reducing knee pain associated with osteoarthritis, specifically of the knee. Now, in knee osteoarthritis, or OA, there's degeneration of the cartilage either on the femur, the tibia, or both. And realistically, we're not going to regrow that cartilage. Once it's gone, it's gone. And so patients will often come in and they'll say, I'm bone on bone here, and they're in pain. And let's say that a patient comes in and they're in a lot of pain because of their knee OA. Well, that pain may preclude them from participating in as many exercises as they probably need to. And if you're going to try and conservatively rehab this knee to prevent surgery, or in the case of prehab where they're already going to have surgery and you want to get them ready for that, having poor exercise tolerance due to pain doesn't help them. So this technique may reduce the patient's knee pain and give them better exercise tolerance, or if you do the self technique at home, which we'll cover in the next video, well then they may have better tolerance to their home exercise program. So this can be a good technique to promote better exercise tolerance because of reduced knee pain. So to perform this, the patient's going to be positioned in prone, as you see right here, and the PT is going to firmly press down on the patient's distal thigh. Okay, I'm going to do that with my right hand here. Okay, so that's my stabilizing hand. I go just proximal to the knee, and I'm stabilizing that femur down to the table. And then I'm going to use my other hand, the left side, and I'm going to bend the knee up to anywhere between 70 and 90 degrees. Normally, I'll start right in the middle at approximately 80 degrees right here. And I'm gripping around with the patient's ankle. And then I'm going to apply an axial distraction with my left hand here along the longitudinal axis of the tibia, and we're going to hold that sustained distraction force. Essentially, I'm just pulling the tibia up toward my left shoulder right here. Okay, let's see that distraction. There it is right there. So in this position, we are distracting the tibia away from the femur, and it tends to work better in this position of knee flexion. Now what you saw right there is I changed the knee angle to about 70 degrees. So there's traction at 70 degrees. I can also try it right at 90 degrees. Okay? Which one do you do? Well, you do whatever works for the patient. Maybe they get the most pain relief at 80 degrees, maybe they get it at 90, maybe they get it at 70. You do whatever works for the patient, right? Okay. And usually with this, I'll do 1 to 2 repetitions, and I'll hold each bout of traction for about a minute. And understand that you can also use Maitland mobilizations. So you can do those oscillations, grades 1 and 2 for pain reduction. You can do grades 3 and 4 for increased range of motion, that is increased distance between the femur and the tibia. And a lot of times this pain reduction that may occur in this position while you're doing the traction will last after the traction is done. And so how do you know if this traction technique worked? Well, you always use the test, treat, retest model. So what's your test? Well, maybe you have the patient walking around before this and you assess their pain level while walking. Maybe that pain level is a 7 out of 10 in that knee. Well, then you get them here and you do the technique, tibiofemoral traction. That's your treatment. So what's your retest? Well, it's whatever the original test was. You have them get up and walk around and ask them their pain level. And if they say, you know what, it went down to, let's say, a 4 out of 10, well, that's a 3-point difference on the pain scale. That can make a difference with exercise tolerance. And if the pain is reduced, then obviously you know that that traction technique worked. And you might consider giving the self-technique version of this, which we'll go over in one of the next videos. Okay, so always use this test, treat, retest model. Okay, so once again, let's take a look at the technique. So stabilize the femur against the table, and then you're going to bend their knee to approximately 80 degrees. That's usually where I start, and you apply the traction there. There's the traction. You can also try different angles. So I'm going to move it initially to 70 degrees in just a second. There you go, there's about 70. I can try it in 90 degrees, but again, you're going to use whatever angle works best for the patient. And right there you saw I was just using a sustained hold, but you can also do those graded mobilizations. Thank you for all your support. Be sure to check out my Instagram for cool science and not science stuff.